take advantage of that, because before you maybe go into that doctor, before you have a question about which treatment decision you need to make, you possibly could find that out first before actually going to the doctor and spending that money. So here's the line, the numbers available to you. I think Rob or Marcella will have them available for you. The nurse line numbers there. You also have the opportunity to go through health coaching for those that participate in the health assessment. So you can get health coaching courses which are free. You can take as many as you want every year on smoking cessation, to fitness, to nutrition, to cholesterol, to better nutrition, etc. So let's shift here into hospitals. So God forbid you ever have to get admitted to a hospital, especially if you're having to be this guy. Don't worry, we've double-checked everything about your operation. There'll be no mistakes today, Mr. Collins. Oh, Mr. Smith. So you see a lot of this in the media lately. There's been errors in the hospitals, which led to some deaths or some arms being removed that shouldn't have been removed. But we want to prevent all deaths in the hospital from starting. So we take all these deaths from these different events. Hospital deaths is actually more than all of these combined. How many people died in Vietnam? 53,000 Americans died in a year. There are more deaths happening in the hospital every year than what died in the home. This is the bubble chart to see if you guys are paying attention. You got your toes here. This is a really confusing slide, but I want to make a good point out of this. This is a study done in New York looking at cancer treatments by all the different hospitals that can perform this cancer in the New York area. So each bubble represents one hospital that can do these cancer treatments. The size of the bubble represents how often or how many times they do the procedure. So the bigger the bubble means they do a lot more of these procedures. The y-axis, length of stay, is just how long a person needs to stay in the hospital after that procedure. So the y-axis at the bottom there, x-axis is death. You can't see it, but it's mortality rate. So the point of this slide is that if a hospital does this procedure for a good amount of time, and you associate that with how long they have to stay in the hospital after that, what's the correlation to death? And what they found was that, okay, it's great that you can do the procedure a lot. That's one good thing. But it's also a good thing to get the person out of the hospital fast. You don't want to be in a hospital. There's pathogens and disease flying all over the place that can lead you to infection. So if you look at Memorial Sloan Kettering down there, the bottom line, they had the most procedures done, and they had the lowest amount of hospital stays, 1.8 days shorter than any other hospital. So they got it done right, they got it done efficiently to get you out of it right away, and as a result, they had 53% lower death rates than any other hospital. So this is research that's done, but we don't have this kind of knowledge for the hospitals. I would love to know the local hospital area, how many times they've killed people from just treating cancer. You want to know that. It's not really open to the public. It's hard to get it. So Dr. Oz, Dr. Work can show you how to do it. So work your wise, find a hospital that does it a lot, and does it without you being in the hospital a long time. So that's it. What's the least important quality in finding a great hospital? Should the hospital be close enough to your friends so you can provide a morale? Should it perform a high numbers of the procedure that you've done? Yes. Hospital should have high marks of quality? Yes. Hospital managerial staff should be board certified? Yes, we talked about that. I like this. The year should have a policy. On your birthday, it's free, right? The least important quality is should be home close enough to your friends. I know if you're going to a hospital, you love to have that support with your family members there. That's great. You want to get out of there. You don't want to have a social hour in there. Everyone's going to be there hanging out. You're there to get better. So, that said, don't try to find a hospital that's close to your mom or close to your dad or close to your family. Find a hospital that does the treatment right and does it quickly, so you're not in there for a long amount of time. So Dr. Oz and Dr. Royce did research on procedures for bypass surgery. How many times do you think you need to do it to have a high-quality hospital performance procedure? 5, 50, 500, 50, or 5,000? That's a lot. If you think about bypass surgery, that's a pretty complicated procedure. Not too many hospitals try and find a hospital that at least does it 500 times. That's what they're saying. The minimum amount you need to have done to have the right quality. So here's some data on that in the hospital here. It's estimated 98,000 patients die every year due to errors in the hospital. So that's pretty scary. 2 million people get an infection in the hospital. 83 million days of illness could have been prevented by receiving quality care. So not only do you go to the hospital try and prevent yourself from getting sick, you can actually get sick. So poor quality, what happens? You get more complications, you get more redo rates. If I'm going to get a procedure done, I don't want to ever go back again. But what happens a lot of times, it's not done right, it's not done effectively, so you have to go back and get it redone. That's the worst. Not only that, it's driving you. You know what's sad about that is you got to pay for it again. You know, if I'm getting my car fixed by a mechanic, and then he messes up on my transmission, I bet you I can guarantee I can get that guy to fix it again for free. But how many times can you get a doctor to do the service again for free? They mess up. You got to pay for it. It's better. So checking on quality is important. You check on ER, see if they are equipped to do the right kind of trauma in this area at different levels. But what I'll talk about is where do you check on hospital quality? On your United Healthcare Options PPO, you can actually pull up a hospital and use some quality data. If you want more independent data as well, you can go to qualitycheck.org, you can go to healthgrades.com, or I think the best website is Leapfrog. And what that is that large employers around this country banded together and said, we want to understand the quality of the hospitals that we're offering to our employees. So they're requiring hospitals that they want to be in this employer's network, or obviously to their employees, they have to submit their quality scores. You can understand, just do a search on Leapfrog, find the hospitals in your area, you can determine what the quality is like. You can actually search by subspecialty. So if you're interested in orthopedics, if you're interested in cardiology, if you're interested in neurology, if you're interested in OBG, you can actually search by the qualities by subspecialties. Okay, God forbid you have to go to the ER. But if you do go to the ER, where should you sit? You should sit on a seat closest near the nurse. Anywhere when you're at any machine, on a plastic chair, probably on a pillow, you can be sitting there. That would be me. I like eating. You're shut the double doors so you can hear me moaning. Speaker. It's on a plastic chair. And the reason for that, you're in an ER waiting room. What's going into the ER? People who are sick or hurt, they're bleeding. They may be incontinent sitting on a fabric chair. Is that fabric chair going to get cleaned up? No. So, sit on a plastic chair. Look at plastic.
I made the whole trip worth it.
Now, wherever you go, you always get to sit on a plastic
Bring your
chair.
own chair. A plastic chair. I'll stun.
Thank you.
On my way out here. Plastic.
All right. God forbid you ever have to get admitted to hospital, but there's certain things that Dr. Boyce would recommend. If you go to a hospital, have one doctor coordinate all your care. Basically, you want that quarterback. That's probably going to be your internal physician, quarterback the care. If you're in a hospital, you're going to have multiple subspecialties. You're going to have your anesthesiologist, you may have a heart surgeon, you may have your cardiologist. So make sure you have one doctor that can quarterback everything for you, and you can actually go to that doctor if you have any questions. Get a copy of your medical chart that's sitting at the back of your bed. Make sure that's you on there if you're talking about it, right? Also, look at all the things that they're doing to you. Look at all the drugs that you're on. You may be put in the University of Wisconsin teaching institution, so you're going to get medical students, you're going to get residents, you're going to get internists, all kinds of people walking through that room. Make sure they understand your condition as well. Check your ID band. That your name on your ID band. Do that Mr. Smith or that Mr. Collins. Make sure that's who you are. But I think the most important thing is declare germ warfare. You saw the amount of infections that happen every year in a hospital, the amount of deaths attributed to infections as well. But everyone that walks in your room, make sure they wash your hands, especially the doctors. They forget. The nurses forget. They may not have gloves on. That's a hospital. They may be next door to the guy that has 90% burns on his body. He's prone to a lot of infections, and he's going to come over there and see you and start touching you. Make sure they wash their hands.